Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Harika ma'am is a highly qualified clinical pharmacist and educator at Monash Health Hospital in Melbourne, Australia. With 5 years of experience as an aggregated consultant pharmacist and a member of SHPA, the Society of Hospital Pharmacists Australia. She excels in preparing students for exams. Harika is passionate about interactive education, aiming to empower students to become effective pharmacists for optimal patient outcomes. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Mr. Arief Mohammad is a skilled clinical pharmacist at Northern Health Hospital in Melbourne, Australia. He brings 5 years of teaching experience and mentorship to students. Certified as a consultant pharmacist, he focuses on home medication review to minimize issues in community and hospital settings. A pharmacist immunizer and a member of the Society of Hospital Pharmacists of Australia. Arief sir is originally from India. He has a robust background as a hospital preceptor and lecturer in Malaysia before relocating to Australia. His dedication to advancing clinical expertise shines through his impactful teaching and practice-based knowledge.
Hello all! Today I'm here to introduce you to the Elite Expertise YouTube channel, a valuable resource for pharmacists worldwide. Our videos comprehensively outline the examination pattern and migration process to countries such as Australia and Canada. Additionally, we provide you information about the exam fees, examination pattern, passing score, and much more. Our channel offers full-length video on various topics like asthma, the autonomous nervous system, and heart failure with complete and in-depth therapy discussion and case studies. We regularly provide timely updates for pharmacists planning international migration. To ensure that you don't miss any crucial information, we invite you to visit and subscribe to the Elite Expertise YouTube channel. Thank you.
Are you an overseas pharmacist aspiring to practice in Australia? By following these 6 steps, you can navigate the path to become a registered pharmacist in Australia. Step 1. Get your skill assessment done with Australian Pharmacy Council. Step 2. Clear your KAPSEXAM. Step 3. Register with APRA as an intern pharmacist. Step 4. Start your internship and clear both intern written and oral exam after completing 75% of your intern hours. Step 5. Complete the intern training program and 1575 hours of supervised practice. Step 6. Get registered with apparatus of fully licensed pharmacists. At Elite Expertise, we are there for you at every step of your journey. Let our guidance and expertise make your dream of becoming a registered pharmacist in Australia a reality. Join Elite Expertise and begin your journey to success today. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Harika ma'am is a highly qualified clinical pharmacist and educator at Monash Health Hospital in Melbourne, Australia. With 5 years of experience as an aggregated consultant pharmacist and a member of SHPA, the Society of Hospital Pharmacists Australia. She excels in preparing students for exams. Harika is passionate about interactive education, aiming to empower students to become effective pharmacists for optimal patient outcomes. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Mr. Arief Mohammad is a skilled clinical pharmacist at Northern Health Hospital in Melbourne, Australia. He brings 5 years of teaching experience and mentorship to students. Certified as a consultant pharmacist, he focuses on home medication review to minimize issues in community and hospital settings. A pharmacist immunizer and a member of the Society of Hospital Pharmacists of Australia. Arief sir is originally from India. He has a robust background as a hospital preceptor and lecturer in Malaysia before relocating to Australia. His dedication to advancing clinical expertise shines through his impactful teaching and practice-based knowledge.
Hello all. Today I'm here to introduce you to the Elite Expertise YouTube channel, a valuable resource for pharmacists worldwide. Our videos comprehensively outline the examination pattern and migration process to countries such as Australia and Canada. Additionally, we provide you information about the exam fees, examination pattern, passing score, and much more. Our channel offers full-length video on various topics like asthma, the autonomous nervous system, and heart failure with complete and in-depth therapy discussion and case studies. We regularly provide timely updates for pharmacists planning international migration. To ensure that you don't miss any crucial information, we invite you to visit and subscribe to the Elite Expertise YouTube channel. Thank you.
By following these 6 steps, you can navigate the path to become a registered pharmacist in Australia. Step 1. Get your skill assessment done with Australian Pharmacy Council. Step 2. Clear your KAPS exam. Step 3. Register with APRA as an intern pharmacist. Step 4. Start your internship and clear both intern written and oral exam after completing 75% of your intern hours. Step 5. Complete the intern training program and 1,575 hours of supervised practice. Step 6. Get registered with APRA as a fully licensed pharmacist. At Elite Expertise, we are there for you at every step of your journey. Let our guidance and expertise make your dream of becoming a registered pharmacist in Australia a reality. Join Elite Expertise and begin your journey to success today. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Harika ma'am is a highly qualified clinical pharmacist and educator at Monash Health Hospital in Melbourne, Australia. With 5 years of experience as an aggregated consultant pharmacist and a member of SHPA, the Society of Hospital Pharmacists Australia. She excels in preparing students for exams. Harika is passionate about interactive education, aiming to empower students to become effective pharmacists for optimal patient outcomes. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Mr. Arief Mohammad is a skilled clinical pharmacist at Northern Health Hospital in Melbourne, Australia. He brings 5 years of teaching experience and mentorship to students. Certified as a consultant pharmacist, he focuses on home medication review to minimize issues in community and hospital settings. A pharmacist immunizer and a member of the Society of Hospital Pharmacists of Australia. Arief sir is originally from India. He has a robust background as a hospital preceptor and lecturer in Malaysia before relocating to Australia. His dedication to advancing clinical expertise shines through his impactful teaching and practice-based knowledge.
Hello all. Today I'm here to introduce you to the Elite Expertise YouTube channel, a valuable resource for pharmacists worldwide. Our videos comprehensively outline the examination pattern and migration process to countries such as Australia and Canada. Additionally, we provide you information about the exam fees, examination pattern, passing score and much more. Our channel offers full-length video on various topics like asthma, the autonomous nervous system, and heart failure with complete and in-depth therapy discussion and case studies. We regularly provide timely updates for pharmacists planning international migration. To ensure that you don't miss any crucial information, we invite you to visit and subscribe to the Allied Experts YouTube channel. Thank you.
aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Harika ma'am is a highly qualified clinical pharmacist and educator at Monash Health Hospital in Melbourne, Australia. With 5 years of experience as an aggregated consultant pharmacist and a member of SHPA, the Society of Hospital Pharmacists Australia. She excels in preparing students for exams. Harika is passionate about interactive education, aiming to empower students to become effective pharmacists for optimal patient outcomes. Are you an aspiring pharmacist and want to practice in Australia? Then we welcome you to Elite Expertise, where we turn ambitions into success for pharmacists worldwide. Elite Expertise is founded by Arief sir and Harika ma'am. Mr. Arief Mohammad is a skilled clinical pharmacist at Northern Health Hospital in Melbourne, Australia. He brings 5 years of teaching experience and mentorship to students. Certified as a consultant pharmacist, he focuses on home medication review to minimize issues in community and hospital settings. A pharmacist immunizer and a member of the Society of Hospital Pharmacists of Australia. Arief sir is originally from India. He has a robust background as a hospital preceptor and lecturer in Malaysia before relocating to Australia. His dedication to advancing clinical expertise shines through his impactful teaching and practice-based knowledge.
Hello all. Today I'm here to introduce you to the Elite Expertise YouTube channel, a valuable resource for pharmacists worldwide. Our videos comprehensively outline the examination pattern and migration process to countries such as Australia and Canada. Additionally, we provide you information about the exam fees, examination pattern, passing score, and much more. Our channel offers full-length video on various topics like asthma, the autonomous nervous system, and heart failure with complete and in-depth therapy discussion and case studies. We regularly provide timely updates to pharmacists planning international migration. To ensure that you don't miss any crucial information, we invite you to visit and subscribe to the Elite Expertise YouTube channel. Thank you.
Are you an overseas pharmacist aspiring to practice in Australia? By following these 6 steps, you can navigate the path to become a registered pharmacist in Australia. Step 1. Get your skill assessment done with Australian Pharmacy Council. Step 2. Clear your KAPSEXAM. Step 3. Register with APRA as an intern pharmacist. Step 4. Start your internship and clear both intern written and oral exam after completing 75% of your intern hours. Step 5. Complete the intern training program and 1,575 hours of supervised practice. Step 6. Get registered with APRA as a fully licensed pharmacist. At Elite Expertise, we are there for you at every step of your journey. Let our guidance and expertise make your dream of becoming a registered pharmacist in Australia a reality. Join Elite Expertise and begin your journey to success today.
Hello, everyone. Good evening to everyone.
Hello,
Good
sir.
evening.
Yeah, good evening.
Good evening, sir.
Yeah, good evening. Good evening. Good evening
Good
to
evening.
everyone. Yeah, good
Good
evening.
evening, sir.
Yeah, good evening.
Good evening, sir.
Yeah, good evening, Shivani. So, good evening to everyone and welcome to the Elite Expertise Orientation session. So today, I'm glad to announce that this is the orientation session, which is going on for November 2024 KAPS students. So I would like to share a few things with you. At first, I would like to share my slide and go a few things with you guys. Okay. So I'm going to share my slide. Okay. So first of all, I would like to welcome everyone for the orientation session of November 2024. So as you know that the KAPS examination is one of the most important steps for the candidates to clear in order to become a pharmacist in Australia. So not only to become a pharmacist, but also to migrate like on permanent residence basis, that is to get the PR, permanent residence in Australia. So KAPS is the main pathway. So without clearing the caps, like it becomes much difficult for the pharmacist to gain the PR, to obtain the permanent residency in Australia. So caps is the essential, and it is the most important for everyone to clear the exam. So once you clear the exam, then you will be eligible to apply for your permanent residency, and you can later you can do your internship and become a pharmacist here in Australia. So first of all, I would like to welcome to all the candidates for November batch. Okay. And I would like to welcome you guys for this orientation session for today, which is going on today. So myself, my name is Arief Mohammad. I'm the director and your teacher at Elite Expertise. So currently I'm working as a clinical pharmacist at Northern Health Hospital in Melbourne. And this is our website of Elite Expertise. So when you have a look through the website, then you can find all the details which is mentioned in the website. And currently, at first, I would like to share a few things regarding my CAPS journey. I started my CAPS journey back in 2016. I cleared my CAPS examination in 2016 in November. And after that, I had to wait for almost 2 years to get my permanent residency, that is PR. And I moved to Australia in 2018. After moving to Australia in 2018, I worked as I did my internship in community pharmacies in one of the community pharmacy in Victoria. And after finishing my internship, then I moved to hospital and I started working as a clinical pharmacist. So for the last 4 years, I have been working as a clinical pharmacist in Victorian hospitals. And yeah, that's my journey. And before I started my CAPS journey, I was in Malaysia. So I was working as a university lecturer in Malaysia as a clinical lecturer. And before that, I also worked in India, as a lecturer and also as a clinical pharmacist in India. So that's my CAPS journey. And yeah, so this is our website for Elite Expertise. So all the things that it is mentioned here, you can have a look through all our courses that we are offering, and our team members, our testimonials, and our demo lectures. So we have got a lot of demo lectures which are present in YouTube, and they are directly which are present here in the website, and it will connect directly to the YouTube. Then, so myself and ma'am, this is Harika ma'am. So we both are the directors of Elite Expertise, and we both are your teachers. So who help you in clearing this CAPS examination. And so ma'am is working in Monash Hospital here in Melbourne, and I'm working in Northern Health Hospital. So we both are the clinical pharmacists. So we have been practicing here in Australia for more than 6 years. And at the same time, we have helped a lot of candidates in clearing the CAPS examination. So as I mentioned that I cleared my CAPS examination back in 2016, and after I cleared my CAPS examination, my friends have contacted me and they asked me to help them out in clearing the examination. So for around 3 or 4 years, I have been working, I have been helping them in clearing the CAPS examination. But there wasn't any platform. Just I used to connect them on WhatsApp or on Zoom, and I used to take the classes to them. But into 2023, we started Elite Expertise. Okay. So before we started Elite Expertise, we both have also worked in another institute here in Australia. So we worked for around 6 or 7 months there. And after that, we started our own. So that is Elite Expertise in 2023. In 2023, June, we have started the Elite Expertise. Then, so a brief journey about the Elite Expertise. So as I mentioned that we started Elite Expertise in last year in 2023, June. And it has been almost 1 year. So we started Elite Expertise, and so far there were totally 4 batches. They have did their CAPS examination. So we are just waiting for the recent batch exam results. So they had the exam done this week. Okay, so they had the exam on Monday, Tuesday, and Wednesday this week, and we are just waiting for their results as well. And we started our first batch in last year in June. And in the first batch, exam was held in July and we got the results. So in the first batch itself, our success rate was like around 87 candidates, they have cleared the KAPS examination. So the success rate was like around 90% plus. And after that, the next batch was held in November 2023. So that was our second batch. And in the second batch, now the number has increased to 99 candidates. So in November batch, total 99 candidates, they have cleared the KAPS examination. The percentage was around 94%. And then our third batch was the candidates, they did the exam in March 2024. So this year. And for March 2024, the success rate was 120 plus candidates, they have cleared the examination. Again, the success rate is 94 plus percentage. Okay. And we are hoping the same percentage of success even for the recent examination, which was held this week. Okay. So even we are hoping the same sort of the percentage for the July batch candidates. And I'm sure that 100% all our students will get the same thing. Like again, they'll rock. Okay. So just waiting for the date of the results. Okay. So this is about the brief journey of Elite Expertise. So we started it in last year in 2023, and it has been like 1 year. And so far, 4 batches, they have did their KAPS examination. Then, and the other thing I would like to highlight is in Elite Expertise, we maintain everything transparent. Okay? So like when the students, they get the result, we also post their result officially in our website. So these are the official certificates of APC, Australian Pharmacy Council. So once the candidates, they get the result, so we also post their official certificate in our website so that it remains transparent to everyone. So when we say that 121 candidates, they have cleared their examination, so we show all the candidates results in our website page. Okay, so that it remains transparent to everyone. So anyone can have a look that who are the candidates, those who appeared the examination, and who are the candidates, they have cleared their examination from Elite Expertise. So everything, it remains transparent at Elite Expertise. Then, so here are a few things that I would like to go in today's session. So the first thing is I would like to give you a brief thing like how the KAPS examination pattern it will be. At first, I will go through the KAPS examination syllabus, and after that, I will go through the exam pattern, how the exam pattern it will be. Then I will also explain that how much percentage that you need to score in order to clear the KAPS examination. And after that, I will explain briefly about the strategies for the preparation, what strategies that you need to follow in order to prepare for the KAPS examination. Then I will talk about the mocks that we have and the handouts, our assignments that we provide, and the team push activities. So all these are the things that I would like to discuss briefly in today's session. So at first, let's start with the KAPS exam syllabus. So I can say that the KAPS exam syllabus is vast. Okay, so it's like an ocean. So, but you need not to worry. So what we did was we have sorted everything for you guys. Okay, so we made everything as simple as possible. At Elite Expertise, like for each and every batch, we keep on working. We keep on referring all the latest references. We'll go through all the latest references and what will be the changes that are occurring in the Australian pharmacy practice. So especially in the clinical practice. So those things that we'll keep on updating in our lectures. Okay. So you need not to worry about this syllabus, but briefly, I will go through all this content which is present in the official website of Australian Pharmacy Council. Okay, so this syllabus is from the official website of the Australian Pharmacy Council. So in the KAPS examination, you will be having 2 papers, that is paper 1 and paper 2. Okay. So paper 1, and both the papers will be held on the same day. So in the morning session, you will be writing or you will be appearing the paper 1. And after you finish the paper 1, then you will be getting 1 hour break. And after 1 hour break, again, you can start doing the paper 2. So in paper 1, The subjects that are involved are, you will be having the chemistry part, okay, and physiology and pharmacology. So chemistry, which carries around 30% weightage, and physiology and pharmacology, which carries around 70% weightage. Okay. So this is the how the pattern or the syllabus will get divided. So 30% weightage will be for the chemistry component, and 70% weightage will be for physiology and pharmacology component. Okay. So in paper 1 and paper 2, you will be getting 100 MCQs. Okay, so 100 MCQs in paper 1 and 100 MCQs in paper 2. So it means that out of 100 MCQs in paper 1, so 30 MCQs will be from chemistry part and 70 MCQs will be from physiology and pharmacology part. Okay. So now let's have a look through in detail about what are the things that we need to study in chemistry and what we need to study in physiology and pharmacology part. Okay. So this is the syllabus for chemistry. So in chemistry, you will be having the organic chemistry, so where we'll be studying about the basic structures of all the base heterocyclic compounds, and also we will be studying about the structures of some medications, some drugs. And also you will be having the medicinal chemistry, where you will be asked, like the examiners, they will ask the questions mainly on the structure-activity relationship, SAR component, okay? And then the drug metabolism, how the drugs gets metabolized, phase 1, phase 2 drug metabolism. So this drug metabolism part, it will be useful for both the chemistry as well as for biopharmaceutics in paper 2. Okay. Then the next important part is the stereochemistry. So from stereochemistry, you can expect at least 2 questions in your final examination. So where you need to study about all the isomers. Okay. And they will ask the questions from any one of the types of the isomers. So it is also a most important part. Then you will be having other components in chemistry, like physical and organic chemistry, analytical, biochemistry component, and some other minor topics like some basic definitions. They will ask what is esterification, saponification, polymerization. So such basic definitions they will ask. And this is the whole syllabus for chemistry part. Okay, so it means that in your final examination, when you get 100 MCQs, out of 100 MCQs, 30 MCQs will be from chemistry component. Okay, and they may ask the MCQ from any one of, from all these components. Okay, so from all these topics, like from organic chemistry, from medicinal chemistry, from drug metabolism, stereochemistry, and they will also ask some mechanism of actions of the drugs. Okay. So drug mechanism of action, which will be asked both in pharmacology as well as in the chemistry component. Okay. So this is about the chemistry part. And then the next part is physiology and pharmacology. So physiology and pharmacology, as I mentioned, that the weightage for physiology and pharmacology will be 70%. It means that around 70 questions from out of 100 will be from physiology and pharmacology component. But when we go in detail, like physiology will carry only like approximately there will be around 15 or 20 questions from physiology part. So here physiology in the sense it includes both physiology and also the pathophysiology part. Okay, so physiology and pathophysiology, then followed by the pharmacology component. Okay, so from physiology, let's say for example, if there are 20 questions from physiology, then 50 questions will be from pharmacology component. Okay, so in this way, they will divide the number of questions, okay, and they will like they allocate the percentage or the weightage for each component. So chemistry, it is 30%. Okay, it's a separate part, it's a separate component, and physiology and pharmacology, they both are combined part. Okay, so combined components, so it carries around 70% weightage. So that is you'll be having around 70 questions. And out of 70 questions, roughly around 20 questions will be from physiology, and the remaining 50 questions will be from pharmacology component. Okay. So in physiology, like they may ask some basic definitions to complicated scenarios. Okay, like what happens in case of left-sided heart failure. Okay, so pulmonary edema can be seen in which type of the heart failure. Such a type of the complicated questions they may ask in physiology component. Okay. Then. And in physiology, they mainly emphasize on the pathophysiology as well. So for all the disorders, so they will also ask about the pathophysiology component. Okay? Pathophysiology, then followed by the pharmacology thing. Then when it comes to the pharmacology, In pharmacology, it is the core component of this part, because it carries the highest weightage. Around 50 questions will be from pharmacology. Okay? So in pharmacology, like you will be having the questions on basic pharmacology, that is the biochemical pharmacology, where you will be studying about the receptor theories, okay? And all the basic things like the autonomic nervous system and the neurotransmitters. So all they come under the basic pharmacology. Then the systemic pharmacology, where we'll be studying about the mechanism of action of the drugs and chemotherapy, toxicology. So all these are the things that they are included in the pharmacology component. So at Elite Expertise, what we do is, how we teach is, so we integrate the subjects. Okay, so we integrate the subjects and we teach all the components like I will explain you. Okay, so when we talk about the paper 2, when we look at the syllabus of the paper 2, okay, then when I talk about the therapeutics, then I will explain you how we teach at Elite Expertise. Okay, so anyhow, these are the things that are included in pharmacology part. Then when it comes to paper 2, in paper 2, again, you will be having 100 MCQs. Out of 100 MCQs, so they will divide like 30% weightage for pharmaceutics, okay, and 70% weightage for therapeutics. Okay, so it will have like 30% in pharmaceutics part weightage and 70% weightage will be for therapeutics part. Okay, so here again, when we look at the how pharmaceutics component is divided, so in pharmaceutics, 30% weightage in the sense like out of 100 MCQs, so 30 MCQs will be from pharmaceutics part and 70 MCQs will be from therapeutics part. So in pharmaceutics, like the first part is the pharmaceutical technology, so which contains, or we can also say that this is the physical pharmacy component, where you need to study about the tablets, capsules, suspensions, emulsions, syrups, okay? The different binding agents, ointment bases, so everything which comes under the physical pharmacy part. Okay? So those things will be one of the components. So you won't get much questions, hardly around 3 or 4 or sometimes up to 5 questions from this component. Then in pharmaceutics, you will also have the calculations. So calculations in pharmaceutics are completely, these are the Sutix based calculations. Okay, so in paper 2, you will be having the calculations, and these calculations, they will divide into 2 parts. Okay? So one is Sutix based calculations and the other is the therapeutics calculations. In Sutix based calculations, they mainly ask about the half-life of the drug, how to calculate the half-life or shelf life of the drug, then volume of distribution calculations. So all those a bit complicated calculations, they come under the Sutix part, pharmaceutics. And in therapeutics, again, you will be having the calculations, so that I will explain about the therapeutics calculations in the next slide. Okay. So, but in Sutix calculations, so for example, in your final examination, let's say, for example, if you get around 15 calculations in paper 2, if you get around 15 calculations, out of 15 calculations, 5 calculations will be for Sutix part, for Sutix related calculations, and 10 calculations will be therapeutics related calculations. Okay, so only 5 will be for Sutix and 10 calculations will be for therapeutics calculations. So this is the rough estimation. So in case, for example, if you get 15 calculations, then 5 will be for Sutix and around 10 will be for therapeutics calculations. Then the most important part in pharmaceutics is biopharmaceutics. So in biopharmaceutics, it plays a major role in paper 2. Like you will get a lot of questions in from biopharmaceutics. Okay, so at least you can expect around 10 questions or 15 questions only from the biopharmaceutics. Okay, so this is the most important component in pharmaceutics part. Then in pharmaceutics, they also included the microbiology and immunology. So from microbiology and immunology, like definitely you will get around 4 questions. Okay, so both combined together from microbiology and immunology. So you will get around 4 or 5 questions. So they also make the part of pharmaceutics. Okay, so in this way, from pharmaceutics, like at the end, when we calculate the total number of questions, roughly around 30 questions will be there in your paper 2. It means that the weightage for pharmaceutics will be 30%. Okay, so there will be around 30 questions, and the weightage is around 30%. Then, if we have a look through the therapeutics part, so from therapeutics part is the major part in paper 2, so which carries around 70% of the weightage. So 70% of the weightage, it means that around 70 questions, 60 to 70 questions will be only from therapeutics component. And in therapeutics, again, what are included? In therapeutics, they have included the calculations. Okay, but the calculations in therapeutics are completely different when we compare to that of the Sutix-based calculations. In Sutix calculations, like they will ask about to calculate the half-life and shelf life of the drugs, okay, and area under the curve, okay, so volume of distribution. So all such type of the calculations will be covered under Sutix part. But when it comes to the therapeutics calculations, so therapeutic calculations are a bit quite simple and easy calculations. So they will give you the patient's weight, okay, and they will ask you to calculate what is the dose of this patient required. Okay, so that is the simple dose calculations or the dilution methods that we use in calculations, the percentage calculation, density, proportions, isotonicity. So all these are the, we can say that they are the simple and easy calculations. So they come under therapeutics component. Then the next part is about the posology. Posology is about, we need to study about all the common medications, the dosage, and so on. Okay, and the drug of choice. So drug of choice is nothing but here we need to study all the major therapeutics component. Like for example, in case of atrial fibrillation, so if a patient has the atrial fibrillation, then in case of atrial fibrillation, if to control the ventricular rate, so what is the drug of choice? Okay, and especially if the patient has developed the ventricular if the patient has already developed the ventricular tachycardias, okay, then what should be the drug of choice? And in case of a patient who is diabetic, type 2 diabetes, okay, and already the patient is on metformin, and also the patient is taking the sulfonyl ureas, okay, now what should be the next drug to be added to control the blood sugar levels? Okay, so all these are nothing but the therapeutics part, that is the applied therapeutics. Okay, so these are the things that you need to study. And drug of choice is nothing but, so they will ask you that in such a situation, what specific drug should be given to the patient. Okay, let's say for example, if the patient is pregnant women and hypertensive patient, so in case of pregnancy and hypertensive condition, what is the drug of choice? Because we got many antihypertensives which are available in the market. So among all the antihypertensives, so which antihypertensive will be suitable agent for pregnant women? Okay, so such type of the questions are the major ones that plays a major role in therapeutics. And also you will be asked the questions on the adverse drug reactions. So what are the adverse effects of the common medications? Okay, and patient counseling. Patient counseling is also an important part. So where they will ask at least 3 or 4 questions on patient counseling. So what counseling points that you will provide to the patient when you dispense the bisphosphonates like alendronate to the patient? So what counseling do you provide to the patient when you dispense the any of the medications, like for sulfonyl ureas? What counseling that you provide to the patient? Okay, so such type of the things that will be included. That is the patient counseling part. And also drug interactions. So drug interactions, they play a major role in paper 2. So you will get at least 5 questions, 6 questions, sometimes 7 to 8 questions from drug interactions. Then apart from these things, they will also ask you the questions on primary healthcare issues. Okay, so like for if the patient comes to your pharmacy with UTI symptoms, then what treatment that you will provide to the patient. If the patient comes to your pharmacy with conjunctivitis problem, then which eye drops that you recommend to the patient. Okay, so in this way, like they will ask about the over-the-counter products as well as the pharmacist only medications. Okay, so all these are the things that they will ask in the therapeutics component. Okay, so finally, like in paper 2, as I mentioned, that there are two major components. One is the pharmaceutics, which carries 30% weightage. It means that around 30%, 30 questions will be from pharmaceutics, and therapeutics, which carries around 70% weightage. So roughly around 70 questions will be from therapeutics part. Okay, so now at Elite Expertise, how we teach is, so I'm going back to my previous slide here. So in paper 1, we have seen that in paper 1, there is a chemistry component. Okay, so for chemistry, I take the separate classes, separate lectures. Okay, so to finish all this chemistry part. And whenever it is applicable, wherever it is applicable, I will also integrate the chemistry structures within the pharmacology and therapeutics part. Okay, so the way that we teach is nothing but it is an integrated method of teaching. So what we do is, at first we'll teach about the physiology part, that is completely about the physiology, then pathophysiology, okay, of a particular disorder. Let's say, for example, if it is a heart failure. So at first, I will explain completely about the pathophysiology of the heart failure. Okay. Then next, I will explain about the pharmacology of the drugs that we use in heart failure, like complete classification of the drugs. So what drugs that are used in the management of heart failure. And then where we'll study in detail, when it comes to the pharmacology, we'll study in detail about the drugs classifications, then each drug's mechanism of action, then each single drugs uses, their side effects, okay, their indications, nothing but the uses, and their contraindications. Okay, and if there are any counseling points, then those things that we'll study. And then I will go into application part. Okay, so application part is nothing but the therapeutics. Okay, that is the applied therapeutics. So when it comes to the therapeutics part, applied therapeutics, so here we will present you some case scenarios, okay, and we will explain everything based on the cases. Okay, so most of the topics we will explain through case studies. It is nothing but we are applying whatever the things that we have learned from physiology, that is from the pathophysiology, and from pharmacology. Okay, so those things we are applying it in the therapeutics. Okay, so that is nothing but the applied pharmacotherapy. Okay, so in this way, all the subjects that we teach, they are integrated to each other, so that it means that you won't be learning separate, like there won't be any separate classes only for the physiology or for pharmacology, then separate classes for therapeutics. It's not like that. So we'll integrate all the three components. Okay, so it means that parallelly you will be studying about the physiology, that is the pathophysiology, then pharmacology, then therapeutics component. Okay, so this is how we have designed our course, so that it becomes easy for the candidates to finish all the things. Okay, so at first they will study about the physiology, then they will study pharmacology, and also they will finish this therapeutics component for each topic. Let's say, for example, if I start the cardiovascular system. So for cardiovascular system, at first I will start with the physiology of the cardiovascular system. Then I will enter into each topic, that is hypertension. Then I will discuss about all the, after finishing the physiology part, I will discuss about all the different classes of the drugs that are available for the management of hypertension. And we'll study about the mechanism of actions and so on. Then finally, we'll go through the applied therapeutics. Okay, so where I'll discuss about the cases, case scenarios, and by doing those case scenarios, so you will come to know that, okay, so in case if the patient is an elder patient, then which antihypertensive drug that we need to select. In case if the patient is a pregnant woman, then which antihypertensive is the best drug. In case if the patient is a younger male, okay, then which antihypertensive is the best one. Okay, so in this way, when once we finish each topic, it means that we are finishing the physiology part, we are finishing the pharmacology part, and also applied therapeutics part. Okay, so in this way, like we have designed the curriculum to make it so simple and easy. Okay, so when you look at the APC website and if you go through all the syllabus, okay, so the candidates, they will be scared. Okay, so when they look at all the syllabus from the APC website, so everyone will get scared, but we made it as simple as possible by integrating the subjects, okay, and made it as simple as possible so that the candidates can easily pass this examination. Now, when it comes to the passing rate or the passing score, as we have seen that in paper one, there are two major components. One is the one is chemistry part, and the other one is the physiology and pharmacology part. Then in paper one, the weightage, here is the weightage. So for pharmaceutical chemistry, the weightage is 30%, and for physiology and pharmacology part, the weightage is 70%. Okay. So in order to pass the paper one, so here the challenge is you need to pass both the papers. Okay, a candidate will succeed in the KAPS examination only when the candidate, they clear both the papers, paper one and paper two. Okay, and let's talk about the paper one first. So in order to pass the paper one, okay, a candidate need to score 50% in chemistry component. Okay, so a candidate must score 50% in chemistry component. So 50% in chemistry component in the sense, so 50% out of these questions. Okay, so let's say, for example, in your exam, if there are 30 questions from chemistry, out of 30, you must mark at least, like you must score at least 15. Okay, so which makes around 50%. Out of 30 questions, you must get the correct answers at least for 15. Okay. And when it comes to the physiology and pharmacology component, like you will be having around 70 questions. So out of 70, you must get at least 35. Okay, so 35 questions should be correct. You must correct at least 35 questions. Okay, then it makes like 50% in chemistry part and 50% in physiology and pharmacology part. Okay, so when you score like 50% in chemistry part and 50% in physiology and pharmacology part, then you will succeed in paper one. Okay, so then you will get passed in paper one. So it's not like overall 50. Yes, overall 50, you must get overall 50 as well. Okay, but at the same time, individual components 50 is also required. So here individual component is, so one is the chemistry component. So in chemistry component, you must get 50%. And the second component is physiology and pharmacology component. So there also you must get 50%. So when you score 50% in chemistry part and 50% in physiology and pharmacology part, then you will pass the paper one. So you'll be considered as successfully passed in paper one. Then when it comes to paper two, again, the same rule is applicable. So in paper two, we know that pharmaceutics will carry around 30% weightage and therapeutics will carry around 70% weightage. Okay. Again, in order to pass the paper two, you need to score 50% in pharmaceutics. Okay, so it means that if there are 30 questions which are related to pharmaceutics, you need to score at least 15 out of it, which makes around 50%. So you need to score 50% in pharmaceutics and at the same time 50% in therapeutics. So out of 70 questions, you must score 35 in therapeutics. Okay? So if you score 50 in both the components, then you will be considered as successful in paper two. Now here the question it arises. Okay? So let's say, for example, if a candidate has scored 50% in chemistry part. Okay, so he has successfully scored 50%. It means that in paper one, the candidate has marked, like gave the correct answers for at least more than 15 questions, for more than 15 questions. So the candidate has marked the correct answers for chemistry. So with that, the candidate has successfully cleared that chemistry component. And also, if a candidate has cleared this physiology and pharmacology component, okay, it means that out of 70 MCQs, the candidate has cleared, have answered around 35 plus, okay, and has cleared the physiology and pharmacology component. Okay, it means that the candidate has successfully passed the paper one. has cleared both the chemistry part and physiology and pharmacology part. So it means that they have successfully passed the paper 1. Now, in paper 2, out of 50% in Sutics, now the candidate has also cleared this Sutics part. It means that the candidate has scored like 15 plus questions in Sutics, and the candidate also has cleared the Sutics component. But in therapeutics, in case if the candidate has scored only 49%, okay, so instead of 50, if the candidate has scored only 49%, that is out of 70 MCQs, if the candidate has got only 34 MCQs correct answer instead of 35, he has lost only in 1 MCQ. Okay, so even if they lost in 1 single MCQ, okay, if they lose in 1 single MCQ, or if they won't reach this 50% mark, it means that they will become unsuccessful in paper 2. Completely, they become unsuccessful in paper 2. Okay, so they will clearly mention that. So you have successfully cleared your paper 1, and unfortunately, you are unsuccessful in your paper 2. Okay, so it means that you are unsuccessful in paper 2, and you are unsuccessful mainly in therapeutics part of the paper 2. Okay, but again, you need to repeat the whole paper 2. Okay, so again, you need to repeat the whole paper 2. Even if you are unsuccessful in one of the components, even if the candidate is unsuccessful in one of the component, again, the candidate need to repeat the whole paper 2. Okay, so the whole paper 2 in the sense, again, they need to pay for the fees. Okay, so when they pay the fees to Australian Pharmacy Council to resit for the examination, the APC will charge the full amount. They won't charge the half amount only for single paper. Okay, so again, the APC will charge the full amount. That is, you need to pay the same the full amount, that is 2,200 and something dollars, in order to sit for the single paper. Okay, so you in order to sit for the single paper, again, you need to pay that full amount to Australian Pharmacy Council. Okay, so in this way, even if we are unsuccessful in one of the components, just in one of the components, okay, so our exam final overall result will become unsuccessful. Okay, so our final overall result will become unsuccessful. It means that we need to wait for the next exam slot. Okay, so a candidate need to wait for the next exam slot, and the candidate need to book for that paper, that particular paper, and the candidate need to sit for that paper and need to clear that paper. Okay, until the candidate clears that particular paper, so it will be considered as the candidates, they won't get the outcome result. Okay, so that is the skills assessment letter. They won't get it from the Australian Pharmacy Council. Okay, but in case if the candidate has cleared both the paper 1, successfully cleared paper 1 and successfully cleared the paper 2, okay, then you will get the overall result as pass. Okay, so you will clear both when you clear both the paper 1 and 2, so your final result will be considered as pass. And after you get your exam result, then Australian Pharmacy Council will issue you the skills assessment letter. Okay, so that skills assessment letter will be essential for you to apply for your internship. That is, you need to get registered with APRA for internship. Those who are in overseas and they want to migrate to Australia, with that skills assessment letter, they can apply for the permanent residency, PR. Okay, so if you don't have that skills assessment letter, it means that you can't do anything. Okay, so you can't apply for your immigration pathway. Okay, and also you can't register as an intern pharmacist. It means that you can't do your APRA registration. Okay, so this is how the exam pattern it will be. Okay, and you will be having 2 papers, paper 1 and paper 2. And you need to pass both the paper 1 and paper 2. And not only the condition is that in both the papers, you need to get 50% in each paper. And there is one more additional condition, that not only scoring 50%, overall 50%, but you must score 50% in each component of paper 1 and paper 2. Each component in the sense, as I mentioned, like in chemistry, you must get 50%. In physiology and pharmacology, you must get 50%. And in therapeutics, you must get 50%, and pharmaceutics, you must get 50%. Then only you will successfully clear both the paper 1 and paper 2, and your final result will be considered as pass. Okay. And once you pass the exam, then you will get the skills assessment letter from Australian Pharmacy Council. And that letter is essential for you to further register with APRA, Australian Health Practitioners Board in Australia. And then you can start your internship. Okay. So any questions regarding this part so far?
No, sir.
Okay, then. So before moving to the next component, so and also like at Elite Expertise, we use all the standard references. So when we prepare the content, we refer everything. Okay, so we refer Australian Medicines Handbook (AMH). Okay, so AMH is the main core. So without Australian Medicines Handbook, without AMH, so the doctors and pharmacists, they can't practice here in Australia. Okay, so everyone, they use this AMH as the basic standard book. Okay, so we refer the AMH, Australian Medicine Handbook, and we also refer therapeutic guidelines, so which is the standard guidelines in Australia for all the health conditions. Okay, so doctors and pharmacists will also go through these therapeutic guidelines. Okay? So we refer therapeutic guidelines, we refer up to date, and also we refer all the standard textbooks. Okay, and we prepare our content by referring all these things. So it means that when a candidate gets enrolled with Elite Expertise, so you need not to worry about reading any other books. Okay, so you need not to worry about opening the other standard textbooks like Sharjal or any other books and keep on reading up over there, because it's our responsibility. So we have already we referred all those textbooks, all the standard guidelines and AMH, and we have prepared our content. And as we know that, like every time, like in medical field, updates will be like it is quite common that every time we'll get the latest updates. So those updates will keep on adding in our lectures. Okay, so for every batch, for each batch, so we'll keep on adding the updates in the lectures. So it means that we will take care of all these things. So you need not to worry about opening any other books. So you need not to refer any books, or you need not to go through any guidelines. Okay, so that's our job and our responsibility. So we will do that thing, and we will teach you after referring everything. So we will concise and we will teach you, we'll present it in a simple way to you. Okay, so you need not to worry about all those things. Okay, so just whatever the things that we teach in our lectures, okay, if you follow those things, then, and also if you do our mocks, and if you follow our handouts, mocks, okay, and our lectures, and also we'll provide some assignments and so on. So I'll quickly run through those things as well. So if you follow all these things, then you need not to worry about referring any other books, okay, or any other guidelines. So before going to the next part, that is the strategies for preparation, like how we make you to prepare for the examination. Okay, so here I'm going to discuss about the few strategies that what we follow at Elite Expertise. So before going to this part, so I would like to invite Harika ma'am. So she will be here soon, and she will she will talk a few things with you guys. Okay, so she will be here soon. And after she finish, then again I'll be back, and I will discuss you regarding these strategies for the preparation and so on. Okay.
Hello, guys. Nice to see you all today, the orientation session. I'm Harika, one of your teachers at Elite Expertise. I'm a consultant pharmacist working in Australia professionally, and I'm working at this stage in Monash Health as a pharmacist, clinical pharmacist rotational, currently working in Children's Hospital, Monash Health in Melbourne. Nice to see you. Hi. Hello, Navdeep. Hello. Nice to see you. So it's a good orientation session where we we'll talk about the agenda for preparation of KAPS and like what we are going to do. And like Sir has briefed you everything. And we've got, on the top of it, we've got an amazing team as well. So we both are educators teaching you. And we've got like KAPS qualified students, Neha, Lily, Shri and Glory and all the others working for us. So let me start just brief of why you should study and like what makes you a successful pharmacist in Australia. So with Elite Expertise, we are very transparent. We are never fake, no fake promises. No, not showing like money in videos and telling that you'll be like earning huge amount after you become a pharmacist or something like that. But definitely Australia gives you a stable lifestyle. For your hard work, you get paid well, and the main healthcare prospects, like for healthcare professionals, no matter like talking about any Western country for that matter, like United States of America, Australia, or Canada, any healthcare professionals, like all these Western countries have a huge investment in health funding. And definitely healthcare professionals are the ones who are sought after every time. So if you're a doctor, you're never sitting idle. If you're a nurse, you're never sitting idle. The same goes with the pharmacist here, where a pharmacist plays a major role in the healthcare system in Australia. So the demand can go up and down, but definitely if you are happy to work hard and put your mind, then you would definitely get a rewarding career in Australia. That much I can say. So when we started out in 2018, we had like nothing. But when we came here, like, no experience, no prior knowledge of Western health, Western pharmacy practice. But we've got into the system and somehow we reached a very good position together here, like, me and my husband, Arief sir, one of your teachers you've just seen him. So at this stage, we are living in Melbourne. So I would say it has been a stable life, of course, challenging with the different cultural, experiences all over, and you don't have your family and not many friends. But and finding jobs like was challenging. But when persistence is the key. If you work hard and consistently work for your goal, then definitely you would find a good result. So just for the KAPS exam, like if you're from India, you would know that we had ancient Gurukula where we have a teacher and student relationship, where a student student stays with the teacher and learns everything, and then once he or she turns into adolescence, then they will go back to the parents. So here we try to inculcate that good communication and good love and friendship between a teacher and student. And on the top of it, we are very transparent. Like whoever is our student, they get into the WhatsApp group where you have like huge community of our students. More than, I think the current group has 500 students, like previous batch students are also currently there who will like exit after this exam result. So we've got those students, and like especially some students like Abuzer, not to forget him. So who's been like a motivating factor in helping everyone. And it's all the students, especially when sharing their experiences with the exam, helping with some tips and tricks. When I teach calculations in the classes, I get new methods from my students saying, oh, ma'am, I have done this method. Let's try this method. This is a shortcut. So I've been enjoying all that, and I've been growing with you all in the classes. And one thing I hear from every batch who exits Elite Expertise is they're missing the classes. And they want to attend the classes, continuously attend the classes even after finishing the exam. So that means a lot to us, and all your blessings and hard work have made us what we are today. And one thing which I would like to say is, like, when I work in children's hospital every week, I'm doing part-time at this stage and like teaching a elite expertise and like handling directorial responsibilities here. So I've seen a guy, a small boy who is like 2.5, not even, I think 2.5, maybe probably, blonde hair, very beautiful to look at. He has that European features, coming, like laughing, jumping to the pharmacy front counter. So that day I was not rotational, I was in dispensary. And he comes very laughing and waves hands and, you know, says hello, how are you, and like very gentle and very beautiful to look at. So when I opened his history and about to dispense his medications, I've discovered he was on medications which is for leukemia, blood cancer. So, and there was in the rotational, like when in the ward practice recently, there was a small elbow infection for a child, and the infection got recovered. Like the infection almost like recovered. There was like a patchy infectious patch on his elbow, and then we've given him powerful IV antibiotics. He's recovered and he's almost going home when suddenly the biopsy reports come, and then the other reports come saying that it's a cancer. And it's metastasis where it's spreading to all over the body. So those cases, like when you deal with those kind of cases, you grow as a human being and you grow as a pharmacist as well. Like, and it's so satisfactory that you're able to help someone. Suppose, for example, I've got a lady who had like her 2 weeks old daughter had a transplantation, okay, a heart transplantation. And after post-transplantation, she had like the baby had 2 times hypertensive crisis, pulmonary hypertension, and then cardiac arrest. Okay, and then when I went into her room after like a while, when the baby started recovering, her mother was so strong and was smiling and looking at the baby gently. So it felt like those struggles which we face is nothing when compared to them. Okay, so we compete, we try for better lives, we've got families, but the struggles, everyone has a struggle in their life. But to be able to smile and move on and then try your best for it is what makes us special and different from others. And it's amazing how, you know, like every life is unique and how you can like change lives, or you can impact or do some contribution, at least smile and give a counseling to that patient, or, you know, address their concerns, etc., etc. You get to see all this when you practice as a pharmacist, the clinician. So yes, of course, earning money is not, it's a goal for everyone, but it's like earning money with a mixture of, you know, these emotions in life and, you know, these experiences will be so rewarding. And that's what I enjoy as being pharmacist here in Australia. And so especially the children, you know, adolescents, like the crazy diseases, they get crazy thoughts, crazy like, you know, some people get into suicidal thoughts, etc., etc., depression, anxiety. So there's so much to perform. Like you've got a mental health pharmacist role, you've got a chemo pharmacist role, you've got a pediatric specialist pharmacist role, you've got an oncology pharmacist role. You've got a vascular pharmacist who just deals with vascular surgery, surgical pharmacist. You've got an ICU pharmacist. You've got an emergency pharmacist. So yes, of course, you won't straight away get into those roles, but once you keep your passion and practice and try your best, you would definitely reach to that stage one day. So did I. Like the same thing happened to me. It's not easy for an overseas pharmacist to excel as quickly competing with the local pharmacists, but definitely it's not impossible thing. You can, like, you know, if you have a goal like that, you can set and achieve it. So with the CAPS preparation, like think about that brilliant way you can impact life. So there was a small baby who got like admitted because of a fever, and like the nurse explained in the hospital ward to give the baby paracetamol, and she didn't explain it properly. And then the mother comes and when I'm just telling, give her just 1.5 ml, And the mother thought she had to give like a big bucket, big bucket of Panadol to the baby. She didn't know. She was so private to it. She didn't even understand it. And when I explained her, this is the way, and she said, oh my God, thank God you're here. Thank God the pharmacist is here. Otherwise, I would end up giving overdose to my daughter who has a premature liver. Okay, so definitely you can change or impact positive health outcomes and prevent medication misadventures once you practice as a Western pharmacist, like a pharmacist in Australia, or anywhere in the world, which where the healthcare system is very strong and stable. Like in United States, it's very like advanced practice compared to Australia, and Australia is trying to reach there in the role for expanding the role of pharmacists, and prescribing rights have increased where we can intervene and prescribe urinary tract infections, talk about hypertension, treatment for hypertension, etc. So the rules are expanding. Definitely, it shows that Australia is seeking more from pharmacists, and if you're able to commit yourself and be consistent and persistent, then you would get into a very good position. It won't happen overnight. Definitely, you would start as an intern for $27 per hour. You won't have like a bed of roses immediately or a big cash flowing at the background. So no fake promises. Everything would be transparent. And if you are able to struggle well, then you would definitely achieve your goal. And the best thing with elite expertise is, of course, the lectures. We have a quarantine where we don't let our students study anything else apart from what we teach, very strict about it. And we won't let our students touch any other material because we don't want wrong information, because whatever we prepare and teach, they're strictly from Australian Medication Handbook and the Therapeutic Guidelines Australia. Completely, we follow those guidelines. Every bit of it, teaching and experience, would be clinically related in our practice. And to maintain our APRA registration, we have to practice as well. We have a set number of hours through which we have to practice as a pharmacist to maintain our registration. So we are practicing pharmacist teaching for you. So it would be an added advantage. And that to a hospital pharmacist, clinical pharmacist, and a consultant pharmacist professionally. So definitely we would bring that experience into, teaching and inculcate your knowledge and practice. So that's an added advantage. The lectures would be brilliant. I'm sure. I'm not just boasting. You would love them. So do all the students love them. The mocks have to be practiced multiple times. So you have a real life scenario where you're able to deal with the questions, different sort of questions. That's the strategy. Basics. We focus on basic foundations very much. So basic foundation classes will be held very slowly and detailedly. Once you get into the flight and when the aeroplane takes off, it's very slow and steady, but once you're up, then we go very rapid. And the revision sessions are like a huge benefit. You would you would be able to solve the exam questions very easily because of the revision sessions. So approximately, I think for last batch, we had 80 plus lectures. Each lecture was around 3 hours, 2 plus 3, 4, sometimes 5 hours. So all the lectures are brilliant. And if you want to clear the exam in first go, lectures are the most important ones. We have got pregnant students sleeping on the bed and listening to lectures. We've got babies listening to the lectures, small babies, 1-year-old baby sitting and watching the lectures. So we are like a family, we wake up, teach, and then sleep. So it's going to be a family thing where our students are family. So students do come and they become our friends. And then the WhatsApp group is amazing, guys. Please utilize it because you make a lot of friends, community in the WhatsApp group, and it's like a combined study where you have other students guiding you and sharing their fear of examination, and you can tell what you feel, or you can help each other. So it's all like a group study. A beautiful platform we have, WhatsApp, where our students discuss everything. And you'll make good friends where you have similar goals and you can help each other. And we've got our student leaders helping each other with some doubts. We've got Neha really motivating students, re-motivating students, and they are KAPS qualified. So you've got amazing help everywhere, wherever you go in elite expertise. So Neha, really, Shri, all are KAPS qualified. Abuzar is a current student. He's like, helping students with everything. And we've got a good app team as well, just to help in case your app goes wrong or, you have some queries. And we've got amazing admin team. So we try our best to help everyone. So please utilize all the resources and please stick to what Elite Expertise teaches. Just enjoy studying and don't like divert yourself to any other coaching institute materials or anything else apart from what we teach, because we are like, maintaining that good quality by searching for different guidelines and making sure you get the right information, because right information is very important to help you clear the exam. So if you have a passion, and if you have a zeal to work hard, then Elite Expertise is definitely a right platform for you. And we are also welcoming those students who are really very serious about their future and career, and who really want to make some difference in the practice in the healthcare system. It's not just like profit oriented or something which is like, which is not ethical. So completely ethical choices in the way we teach and the way you listen to lectures. So, and we don't count hours on how many hours we spent with you. So that's an added advantage. So 3 points to remember. Lectures. First thing, lectures are so important. It's all our hard work. Mocks, very important to help you understand the concepts and apply them properly. And then the handouts for quick revision. You don't have to prepare like any notes. Just listen, and you will clear the exam in first attempt. So this is what other students experienced over the last 1 year. I think we've got like more than 300. I think 300 plus. Two batches and one more batch in July. So I think approximately more than 300 plus students who have cleared the exam. All these certificates are on our website, very transparently displayed. No, nothing which is opaque. Everything is displayed. APC web certificates are displayed, and we've got our interns as well who are training under us. So it's going to be amazing. You're in the right hands, but you just have to utilize it, and please have that persistence, to continue it after even clearing CAPS, to continue your hard work so that you will reach your goal one day. It might delay or it might be quicker depending on your luck, but hopefully once once you put on those efforts, you'll definitely reach your goal one day. And please maintain that passion for healthcare profession, because it's so rewarding emotionally as well. Thank you. I think I will over to, whom do I over to? I think I'll over to Arief sir, and he will continue with the team introduction. Thank you, guys. Yes, dear, Summer.
I have a question.
Yes.
Ma'am, I want to ask that after passing CAPS, in how much time you get the internship in Australia?
So it depends. So 2025, there are like lots of positions being released. 2024 had no positions, like very less amount of positions were there. But 2025, I've seen a lot of banner groups releasing their positions. That's what I have seen on the LinkedIn pages and the seek.com. So it all depends on the time. Okay, so some people wait a long time. Some people get it instantly. So, but finally, I can't really tell you how much time. It depends on your luck and the time of the year. Okay, completely on it.
Hi,
Okay.
Harika
Okay,
ma'am.
ma'am, thank you.
Yes, dear. Hi.
Ma'am, after finishing CAPS exam, in how many years it is valid to complete internship?
Yeah, so CAPS is valid for 3 years. So after, suppose if today the CAPS validity is expiring after 3 years, okay? So before the expiry, just before the expiry, you can start the internship.
Okay, just
Okay,
before this,
and internship doesn't like, yeah.
It's like we have to complete within 3 years, or
No, after 3 years, within 3 years, you have to start the internship, not
Okay.
complete the internship. Within 3 years, you have to start the internship. Suppose if I clear CAPS in 2021, okay? So 2021, then I have to start internship. Suppose this is July. So I've cleared CAPS in July 2021, 2021 to 2022 to 2022, 23, 24. So 3 years, I have to start internship before the expiry of CAPS. And then you have 1 year of internship. So 3 years validity you'll have to start the internship, not to finish the internship.
Okay.
Okay.
Harika, ma'am, actually, I joined this CAPS like Elite Expertise in April.
Okay.
I want to give the exam in November. Can I personally talk to you because you always help and you always motivate? I am really feeling non-motivated.
No. You can definitely talk. So my WhatsApp number has lots of messages. Definitely in
Yeah.
class, you can talk to me personally after the class. That's the quickest way you can talk. Otherwise, you can definitely WhatsApp me and I'll reply. Okay, but the replies would be a bit delayed depending on like the priority. But definitely you can talk to me in the class as well. And you can talk to me on the WhatsApp. You've got my number in the group, so you can talk to me there.
Thank you.
India. Okay, guys. I'll over to Arief sir, and he'll continue the session.
Thank you, ma'am.
So, hi guys, I'm back again. So I just want to discuss like few strategies for preparation for the CAPS examination, and like how and what things that we follow here at Elite Expertise. So those are the things that I'm going to discuss briefly with you. So here, the main thing in order to clear this CAPS examination, as you all have seen the syllabus of the CAPS, okay, so it's a bit vast syllabus. So we we need to have a proper strategy for preparing for this examination. Okay, so if we won't prepare in a proper way, if we don't have a proper strategy, then it becomes much difficult to clear this exam in the first attempt. Okay, so we are here to make sure that each and every candidate, they clear their examination in their first attempt. So so for that, even from your side, you need to put a lot of efforts as well. So to make sure, like whenever we finish the lecture, immediately you need to do a sort of revision for all the lectures, and you need to do the assignments as well as the mocks and so on. Okay, so I will explain a few things like what you need to do exactly. So for this 3.5 or the 4 months until you sit for your November examination. So the first thing is you must attend the live lectures. So live lectures are the most important one. Okay, so try to I know that like most of the candidates, like everyone are working professionals, and you are in different countries as well. Some of you are in like in India, in Asian countries, and in also in some of you might be from Europe and so on. Okay, so it becomes much difficult for anyone to attend that live lecture, okay, because of your work and so on. So, but at least on weekends, whenever it is possible, try to attend the live lecture so that you can interact directly with the lecturers. And even if you can't attend the live lecture, immediately once we finish the live lecture, so we will upload that lecture in the app. Okay, so you need to watch that lecture soon. And after watching that lecture, in case if you have any questions related to that topic, so you can note down all those questions. And whenever the next live lecture is going on, so try to attend that next live lecture and you can ask those questions to us. Otherwise, we have the WhatsApp facility. So you all are in the WhatsApp group. Okay, so you can just post the question in the WhatsApp group. Then one of us will answer your questions. So try to attend the live lectures as much as possible. Then there will be certain pre-learning modules will be provided for you. So you need to do those things as well. So for certain things, like before when we go to the revision part of the syllabus, okay, so we'll give you some pre-learning modules. So you need to go through all those pre-learning modules before you attend the revision lectures. Then at Elite Expertise, we'll provide you the assignments, okay? And for most of the topics, like there are some assignments. So whenever the topic is done, then immediately we'll post the assignment for you. So you need to do those assignments on time. Okay. So if you attend the live lectures and if you do those assignments, then you will never forget about all those things. Okay, what are the things that you have learned? Okay. So all the important things that you will remember even till the end, until you sit for the examination. And we'll be having the mocks. There will be around 16 mocks at the moment, and we are still updating few other new mocks. Okay? So you will get the access to do the mocks in ProProfs. That is another platform. Okay, so I'll go through those things as well now. So you need to do the mocks, and also you need to do the grant test. And like whenever a topic is done, whenever the system is completed, then immediately you need to go and appear for the mock related to that topic. Okay. So then only you will become more familiarized with that topic when you answer the questions. Okay. Then quickly refer the information presented in the handouts. So we also provide the handouts to you. Okay. So handouts also makes a very good so once the lecture is done, if you can quickly refer through those handouts, then everything that you can recall from the lecture topics. Then we also have the team push activities. So what we do is like we'll assign you in different groups or in the teams. Okay. And all the team members will be given some assignments, like I'll be after finishing my lecture, so I will be asking the candidates to keep on collecting the keywords related to that topic. So the candidates need to keep on collecting the keywords, okay? And so on. So all the candidates, they must be involved in the team push activities. So it becomes a very good learning aspect from your peers. So they will force you to finish that assignments and force you to collect all these keywords and everything. It will be done. So it means that you will stay like even if you are not willing to do on time, so they will force you to do it and they will force you to submit it. Okay. So it is a very good activity. So that we have introduced and we are practicing these things. Okay. So if you follow all these things, okay, and attending the live lectures, preparing your notes from out of the live lectures, so you will be having the handouts. Definitely you will be provided with the handouts. But apart from the handouts, if you want to add any further points, then you can just keep on adding those things on the handouts. Okay. And assignments is the important one. So you must finish all the assignments on time, and mocks, which are the most important one. So you must do all the mocks, okay? And you need to stay updated with all the things. And also you need to involve in collecting the keywords and all the things which are involved in the team push activities. So if you follow these things for the next 3 months, okay, so for the next 3 months, so if you follow all these things, then you will 100%, everyone will clear the KAPS examination in the first attempt. Okay. So these are the strategies that how we follow, how we make our candidates to prepare at Elite Expertise. Then this is the sample for the assignment. For the assignment, when we provide you the assignment for any topic, okay, so there will be like, for example, let's say, for example, if there are around 50 or 60 questions in this assignment topic, and for each question, you need to give the answer in 1 or 2 words. You need not to write everything about that topic. Okay, so just in 1 or 2 words, briefly, you need to explain it. Okay? So in 1 or 2 words, you need to give the answer. And all the assignment topics, the answers for the assignment topics will be discussed during the revision lectures. So during the revision lectures, so whenever I take the revision lecture, so during that time, I will discuss the answers for this assignment topics. Okay. So this is about the sample assignment. And then, so this is your Elite Expertise app. So in the app, like you will be having all the lectures will be only through the app. So you need to log in through the app, and also once the lectures are done, then they get stored in the app. Okay, so all the recorded videos will be there in the app, and you can watch, you can visit n number of times, and you can watch it n number of times. Okay, so you can you can keep on watching those videos. Okay, and all the videos will be there stored in the app. And currently, guys, like we are providing the training for KAPS examination, for preparation for the KAPS examination, and also we are providing the training for intern pharmacist written examination and intern pharmacist oral examination. Okay, so these three are the exams for Australian licensing exams. So KAPS examination, when after KAPS examination, the next one will be while doing the internship. So it is the intern pharmacist written exam and followed by the intern pharmacist oral exam. Okay, so we are providing all the Australian licensing examination trainings, and at the same time, we have launched 2 new courses. One is the Pearson Test of English, that is the PTE. So PTE, as it is mandatory for all the candidates, once they finish their KAPS, then the next step is they need to clear one of the English language test. So and like either they can go with the IELTS or PTE or OET. So there are multiple options. So we have launched the PTE training program. So starting from this week, okay. So that's the another one. And from this week, we have also starting the Canadian licensing examination, that is the PEBC. So these are the courses or the trainings that we are providing at the moment. So, but for KAPS exam, when you log into your app, okay, so it will show you it will show you with a folder of KAPS. So where you can go to KAPS and you can access through all the videos as well as all the assignments and all the things that we provide. So it will be there in the app for you. Then for mocks, we are still using the ProProfs. So ProProfs is the one where you can do all your mocks. So once you log into your ProProfs, so we will be provided with the username and the password for the login details. So once you log into your ProProfs, so all the mocks and the grant tests will appear in the ProProfs. So you can go and do your mocks and the grant test in the ProProfs. So here, even in ProProfs, like you can, in case if you have done your first mock number 1, then if you want to repeat the same mock, then you can keep on doing it n number of times. Okay, so you can keep on repeating to practice yourself. So you can repeat all the mocks n number of times. And the advice that what I would like to give you regarding this mocks is, so you need to do each mock. Okay, so you must do each single mock at least 10 times, and like before you sit for your examination. Okay, so let's say, for example, today, if you have done the mock 1 after finishing the syllabus, which is related to the mock 1. So if you have done the mock 1, then after a few days, when the mock 2 syllabus is done, then when you do the mock 2, then after a few days, then mock 3 syllabus is done, then you will do the mock 3. Then after that, what you need to do is you need to repeat the mock 1 again. Okay. So to make sure that you keep on, you keep in touch with each type of the topic, you keep on repeating those mocks. Okay. So at least 10 times you need to do the mock, and also you need to record your scores in the mock. Okay, so we'll provide a sheet to you. Okay, so in that sheet, you need to keep on recording your scores. That is, you need to write today's date and how much percentage, what is your score in mock 1. Okay, and that is first attempt 1. So how much percentage that you have scored in mock 1. Then in mock 2, how much percentage you have scored. Mock 3, how much you have scored. And again, after 1 week, when you repeat the mock 1, the second time, when you repeat the mock 1, now at this time, how much percentage you have scored. let's say, for example, if you have scored only 56% in your first attempt in mock 1, then when you do the mock 1 again in the second attempt, so your score will increase up to like more than 65 or 70%. So you need to keep on recording. You need to keep a record of all those mocks and all the assignments, mocks, record, and the other team push activities record. So everything that you need to maintain properly. So at any time, whenever I ask you to show your progress, then you guys need to keep on showing the progress to us. Okay. Then, so that's about the mocks. So all the mocks will be there in your ProProfs. Okay. And now it's the time to meet our team members. So we have a very good supportive team. Okay. So because of this team, they help us in building this app, and also they are helping us to run all these things. Okay. For framing the timetables and so on. So I would like to introduce the team of Elite Expertise so that you will get familiarized with them, and you will come to know that to whom you need to contact in case if you have any issues or so on related to the app or related to the topic and so on. So I would like to introduce to our team. Okay. So the first person is Ashita. So she is our admin team manager. So she looks after all the major aspects related to the Elite Expertise. Okay. So Ashita, are you here?
Yes, sir, I'm here. I'm here.
So over to you, Ashita. So
Yes. Warm welcome to the distinguished pharmacists present over here. I'm Ashrita, working as an admin manager of Elite Expertise, where knowledge meets practice. Like whatever your pharma knowledge will be made into the practical knowledge, not only in your CAPS, PEBC, that anyone can do, right? But when you're working in a practical way, then you'll remember Arief sir and Harika ma'am. So we are a team of 10 members of highly qualified pharmacists. We have Shri, our the main, the head for the digital marketing, social media marketing, who is a CAPS qualified and a registered pharmacist. We have Neha, who is a CAPS qualified, who is other one is Rilly, who's again a CAPS qualified. Glory, she's a student of Elite Expertise. Rajat, CAPS qualified. We have Ashtosh, a pharmacist, like not he's a pharmacist, he's a he comes from a background of forensic, but he's a great asset to the team. We have Hira, she's a younger and energetic girl who does all the video editing. We have Sahana, head of the content. So we are of a team of 10 to 15 people who will be serving each one of you. So round the clock, each one of the student have messaged us in the night, 4, 3, 2, 1. We are the one who is giving you the reply. And this is Arif sir who is giving you the lecture, Harika ma'am. And we have 2 updates from our team. One is along with the CAPS, we are launching the PTE coaching. That would be on every Thursday, Friday, Saturday, and Sunday, 4 days a week. It would be a practical approach. Rather than going to other institution without not having any practical knowledge, it's better that we just came up with this idea because all our passed out candidates were asking us. So the second update is a PEBC exam. There are many students who were asking Harika ma'am and Arif sir, like why you have stopped just the wings to only Australia, New Zealand? Why not to Canada? So they have decided to launch their expertise students pharmacist in the land of Canada itself. So tomorrow, ideally, we are having that orientation session as well, guys. So if you have any issue, any problem, any guidance, any positive, negative feedback, anything, we are always there. I know you must not all having our numbers. So we are always helpful to you. And let me congratulate each one of you in advance for qualifying CAPS exam in November 2025. I'm sure you'll be November 24. I'm sure you'll make it. And the second thing, for choosing Elite Expertise as your gateway. That's all from my side, sir. Maybe I'll hand over to the next team members.
yeah, thank you so much, Ashita, for a lovely.
You're welcome, sir.
Yeah. And our next team member is Sahana. So Sahana is our quality control manager. So she will look after everything like how the quality is going on regarding the content preparation and so on. So Sahana, if you are here, can you
Yes, Arif, I'm here. Yeah. So, hi, everybody. I hope you're all having great time here listening to Arif and Harika and all their insightful knowledge. When I come to the situation, this quote pops into my mind, which says that teaching is not just filling a pail, an empty bucket. Filling an empty bucket is anybody could do it, but igniting the student is what Arif and Harika can do the best. Is what I feel from my colleagues and team members. I understand that their teaching line, the teaching way is so different from the others that it becomes so easy for you all to learn from them. So, guys, all I can say is learn the best from them. Don't go anywhere for any other materials and everything. Just stick with them, and they will do the rest for you. That's all I got to say. And I welcome you all to the Elite Family Quarantine, as Harika says. Yeah, thank you.
Yeah, thank you so much, Sahana. Thanks a lot. Then our next team member is Riley. So Riley is one of our students. Actually, she cleared her CAPS examination in November 2023, and she's one of the team members of Elite Expertise. I guess most of you might have already spoke to Riley before you enrolled here in Elite Expertise. So Riley, are you here?
Yes, sir, I'm here. So I am Riley. I'm CAPS qualified, and welcome you all actually first. So I'm actually happy that I can see so many members here, and I know that you people have so many questions, still doubting that is it the best choice you have taken or not. But I can tell you, as an alumni in Elite Expertise, this is the best option that you have. This is the best decision you have taken ever. And sir and ma'am will teach you everything that just trust them. You just have to go with them. What they teach, go with the handouts, go with the mocks, watch the lectures 2 or 3 times. You don't have to doubt what they are teaching actually. So just trust them and then do whatever they say. That is the only thing, that is only advice that I can tell you as an alumni. And I have only followed what they have taught us. And all the best, actually, everybody. I believe you all will clear KAPSEXAM, and this is the best decision you have taken. And thank you so much, sir.
Yeah, thanks, Riley. And actually, like whenever the students, they have some downtime. So Riley and Neha, so they both are the main persons. So who will be organizing some, what do you say, meetings with the students, and they helped a lot to the previous batch students in motivating them to appear for the examination and so on. So especially like it happens 1 month before the examination, all the students, they will get a lot of nervousness, and some of the students, they might think that they want to drop from the exam and they want to appear for the next batch. Okay, so for the next batch of the exam, but Riley and Neha, so they both are our CAPS qualified students. So they helped the students a lot to all the other batch students. Like they motivated the candidates and they will boost the internal energy for the candidates. So thank you so much, Riley. Thanks.
Sir, can I add one more thing?
Yeah, sure. Sure.
Actually, I'm from Kerala, so if there is any Malayalis, you can definitely talk to me.
Yeah, sure. Like really is one who will organize the session, especially in Malayalam, for those who have any problems like in like those who would get the nervousness before 1 month before the examination. So for them, really will organize a special sessions in Malayalam.
Thank you, sir.
Thanks, Lily. Thank you so much. And our next team member is Neha. So Neha is also one of our students. Before, she cleared her CAPS examination in November 2023. And like Neha, I just want to add few things about Neha. So Neha, actually, she joined Elite Expertise just 30 days before examination. And she prepared only 30 days for the exam, and she cracked the exam within 30 days. Okay. So Neha is here, and Neha will also be one of the main supporting team members for you. And if you have anything to talk to them, then Neha and Riley, they both are the main supporting team members for you. So Neha, are you here?
Yes, sir, I'm here. Thank you, sir, for the beautiful introduction about me. Hello, everyone. Welcome aboard. Myself, Neha. I'm a KAPS qualified student. Currently, I'm working as admin manager for Elite Expertise. Like, Elite Expertise is committed to supporting you throughout your KAPS journey. As Harika ma'am and Arief sir said, we are here to support you throughout your KAPS journey. And some inputs that I want to give you before you start your KAPS preparation is like monitor your progress. Like we understand everyone don't have the same style of reading, learning, and understanding the concepts. Since ma'am and sir provides you the comprehensive coaching of all the subjects from starting from ecology, therapy, structural chemistry, everything. They put everything at a place and make everything like a cakewalk for you. Take advantage of that and take advantage of live lectures. If you cannot attend them, try to attend the recorded sessions. We have like many advantages in Elite Expertise. I would like to tell you that you are under the safe wings of Harika ma'am and Arief sir, and I would like to stress this word. In case if you face any kind of difficulties, if you have any doubts, or if you need any kind of assistance, like me, Riley, and Glory will always there to clear your doubts, or we are here to support you actually. And good luck for your future endeavors, and trust the process mainly. Since it is a 3.5 months course, we don't learn anything at a single night. It takes time for everything. Don't doubt yourself. Take time, learn everything, and give your exam. That's it. Good luck, and thanks for joining this orientation session. Have a good evening. Thank you. Thank you, sir.
So much. Yeah, thank you so much, Neha. Then our next team member is Sri. So Sri is also one of our students at Elite Expertise, and he also cleared his KAPS examination back in November 2023. And he's one of the main person at Elite Expertise. He's the one who handles all the technical issues and so on. So Sri, are you here?
Yes, sir. Can you hear me?
Yeah, I can hear you.
Hi, everyone. So I am thank you for a wonderful introduction, sir. So I am Sri. I'm also KAPS qualified in November. So if you have any technical issue like in app or prof or any technical expert, you can definitely contact me, or there's Vikas is there. He can also help you. And you have so many questions when you're joining, right? Look, I also from Sri Lanka. When I also joined, I have so many questions whether I took a right path or not. But definitely, I can say you are in a safe track with the Elite Expertise. And I cleared KAPS like I just watched sir's lectures and did the mocks and just cleared the exam. It's so easy if you stick on the sir's lectures and the mocks. So my advice is don't look for any other resource. Just stick to the preparation and the process you are going. Like you can definitely crack this exam. So that's all from my end. All the best for your preparation. Thank you, sir.
Thank you so much, Sri. So we also have other team members. Rajat is also one of our KAPS qualified student. So he has recently cleared his KAPS examination like in March 2024. Rajat, are you here? I guess Rajat is not here. And we also have Glory with us. So Glory is one of our current students. So she's also helping us in a lot of aspects. So Glory, are you here?
Yes, sir, I'm here. Can you hear me?
Yeah, you can.
Yeah, sir. Thank you for introducing me, sir. Hi, everyone. This is Glory. I'm a student as well as Deputy Admin Manager of Elite Expertise. A warm greetings to all the KAPS aspirants present over here. I would like to say a few words. You have already chosen the best institution, that is Elite Expertise. And you also have the amazing lecturers who are Mr. Arief Mohammad sir and Mrs. Harika Bheemavarapu ma'am. They have exceptional knowledge and experience in providing the quality education to the CAPS students. And it is just a matter of 3 months, I know, and be focused towards your career and be focused towards your goal. And all the best to all the people who are writing the CAPS examination in the month of November. All the best, guys. Thank you so much, sir. Thank you, everyone.
Yeah. Thanks, Glory. Thank you so much. And we also have got a lot of backend team members, so who help you in helping, like who are the main ones who are helping you in the app, and also if any technical issues and so on. So we have Ashutosh here. So Ashutosh, are you here today?
Yes, sir, I'm here. Thank you, sir. Hi, I'm Astosh. First of all, like I'm the one who is torturing guys to download the app and check mocks and everything. And you have chosen the blessed platform. Like just blindly go with Arief sir and Harika ma'am. And we are having motivation classes as well, from Neha and really. That's all from my end, guys. And welcome to Elite Expertise. Thank you, sir.
Yeah, thank you, Ashutosh. And we also have Hira with us. So Hira is also one of our team members. So she will also help you in case if you have any technical problems and so on. So Hira, are you here today?
Yes, I'm here. Hello, everyone. My name is Hira, and I recently joined Elite Expertise on June 21st as an editor. It's my pleasure to welcome you all to our community today. And I'm honored to be a part of such a vibrant and a supportive environment of Elite Expertise. And the esteemed teachers like Arief sir and Harika ma'am are incredibly friendly and always willing to help. They are not just teachers, they are mentors who are genuinely care about your success and development. And thank you once again. Welcome to Elite Expertise. Thank you, sir. Thank you very much.
Yeah, thank you so much, Hira. And we also have Vikas with us. So Vikas is the one who looks after all the app issues. So in case if you have any technical problems related to the app, then you can contact Vikas. Okay? So Vikas is the one who will look after the app issues. So not only Vikas, like you can just message in the WhatsApp group. You all are in the same WhatsApp group. So once you message in the WhatsApp group, then all the team members, so any one of the team members, so they will respond to you, and they will contact you in person, and they will help you to rectify the issues if there is any issue related to the app, or if you don't know how to go through the lectures, or if you don't know how to use the app. Okay, so for all those things, all the team members will be there to support you, and they will be ready to help you out. Okay. So thank you so much, guys.
So, sir, we have Jilani as well.
Okay, sorry. So we have one more team member here, Jilani. So Jilani is also one of our main support team members. So he will also help you in case if there is any technical issues or anything, then you can also contact Jilani. So Jilani is from Kerala. So if there are any Malayali students who want to speak, especially in Malayalam, with our team members, then you got Rilli and Jilani with us. So Jilani, are you here?
Yes, sir, I am here.
So he's Mr. Jilani, and he's from Kerala, and he's helping us a lot in managing all these technical issues and so on.
Like he's a major resource for doing the skill assessment, sir.
Yeah. So he's the one who is handling the skills assessment of the candidates. So yeah. So he'll be in touch with you. Okay. So for skills assessment, those who are seeking the skills assessment and so on.
Okay. Thank you, sir. Thank you for
thanks, Jilani. Yeah. Thank you so much. Yeah. Yes. So that's it from our side, guys. So once again, I would like to thank everyone for joining this session of orientation today. And in case if you have any questions, then we are happy to answer the queries.
I would like to ask you about the CAPS exam is same for the New Zealand pharmacist registration as well?
Yeah, this is the same. So KAPS exam is the same for both Australia and for New Zealand. Okay. So, but the difference, it arises only with the initial step. So for Australia, you need to do your skills assessment through Australian Pharmacy Council. But if you are willing to practice in New Zealand, then you need to do your skills assessment by New Zealand Pharmacy Council. Okay. But after doing the assessment, when you get the eligibility to sit for the exam is the same exam, same paper, everything will be the same, because this exam will be conducted by the Australian Pharmacy Council for both the countries, for Australia and New Zealand. For both the countries, the exam will be conducted by the Australian Pharmacy Council. So the only differences, it arises in the initial skills assessment step. So here the major difference that I can let you know is, one is the English language requirement. Australia, it won't ask the English language score before you sit for the KAPS examination. But for New Zealand, they will ask to provide the English language score first. Okay? So once we provide the English language score, then only they will give the eligibility to sit for the KAPS exam. But Australia, it won't ask the English language score before the KAPS examination. Of course, we need to get the English language score, but we can do this English language even after clearing the KAPS examination. So we can do either PTE or OET or IELTS. Okay? So we need to take the one of the English language tests, and we need to submit the score to APRA before we get registered as a provisional pharmacist. But for New Zealand, at first we need to clear the English language test, then only we need to sit for the KAPS exam. So that's the major difference between Australia and New Zealand. But here again, let's say for instance, like if you have cleared the KAPS examination through Australian pathway, okay, so you have cleared your KAPS examination through Australian pathway, but after clearing this KAPS examination, you have decided to work in New Zealand, not in Australia. So now it doesn't matter. So you can still work in New Zealand. So your exam result will be valid. So what you need to do is, again, you need to get your documents evaluation done. That is the initial skills assessment done through New Zealand Pharmacy Council. So if you do it through the New Zealand Pharmacy Council, then that's fine. Then New Zealand will consider your KAPS result score.
And sir, what if we go through the New Zealand registration route, clear the KAPS, and that exam result is valid for Australian registration as well?
Yeah. So both either.
Both
so
ways.
if you can clear the KAPS through New Zealand pathway, and you can come to the Australia as well, because this KAPS result, the score is finally acceptable in both the countries, both in Australia and New Zealand. So the only difference, it arises with the initial document evaluation. So even if you have done the document evaluation through New Zealand Pharmacy Council, again, Australian Pharmacy Council will ask to redo it again through Australian Pharmacy Council. So it means that again, you need to redo your document evaluation.
And second thing I would like to ask you, when we try to register for the KAPS exam, on the page, it shows 3 different dates of the exam.
Yeah.
But
no, yeah, so you can select any one of the dates. So when it comes to the exam, okay, so you can select any one of the dates. So let's say, for example, now here, recent exam was held on 15th, 16th, and 17th. So you can select any one of the dates. So if you want to give the exam on the day 1, so you can select the day 1. If you want to go with the day 2, or if you want to select the day 3, then you can select the day 3 as well. It doesn't matter. So what will be the date that you prefer? So you can select your examination slot on that particular date. But please make sure that if you are particular to select one of the days, okay, to make sure that you need to book the slots a bit earlier. Okay, so don't wait for the last moment. So if you can book the slots a bit earlier, then what happens is you will get the chance to sit, you will get the chance to take the exam on that particular date, okay, that you prefer, and in the center that you prefer. For example, if a candidate wants to sit the exam in Hyderabad in India, and if the candidate has been already the dates are coming closer, okay, and if the candidate hasn't booked the slot in Hyderabad, then what happens is all the slots in the Hyderabad center will get filled up. So now the Pearson, it will say you that you don't have any centers left, any available left in Hyderabad center. So you need to select any other Pearson center. Like you need to travel to Bangalore, or you need to travel to Mumbai or to Chennai. Okay, so such things will happen. So that's why always I recommend the candidates to book the exam dates. So as soon as the slots they get opened.
And the last is regarding the
Yeah.
mocks and the grand test. The mock test and the grand test in the apps are similar to the one in the pro POFs.
Yeah, they both are similar, but always we recommend to go through the ProProfs. Okay, so you also have the same things in the app, but go through the ProProfs at the moment. Okay, so we are doing the transition from ProProfs to the app. Okay, but it is not yet done. So at the moment, like still follow the ProProfs.
Okay, all right. Thank you, sir, for clearing my few doubts. Yeah.
Yeah. Thanks, Samar.
Hello,
Hi,
sir.
sir.
Hi, Mohini.
How are you, sir?
I'm good. I'm good. Thank you. How are you?
I'm good too. Actually, I'm in Melbourne only from last 3 months.
Okay,
And
okay.
I'm from industry background, and like after my M.Pharm since 2015, I used to work in industry, so I'm not at all in contact with the studies.
Okay.
My knowledge at present is zero, totally zero. So I'm really very bit.
No, don't worry, Mohini. Like I can share a few examples. Like I can say that we have trained for such a candidates like those who have more than 30 years of gap. They have cleared the CAPS examination in their first attempt as well. So like they have cleared the exam, like they have they did their graduation. It was like long ago. Then they had like more than 30 years of gap for their studies. Okay. So even such candidates, they have cleared the examination. So you need not worry about those things. So there were many candidates who had like 15 years gap, 10 years gap, 20 years gap, 30 years gap. So they cleared the examination in their first attempt. So you need not worry about it. So once we start taking the lectures, then you will come to know about those things.
Sure, sir. Actually, one of my friends, she cleared in March, so she only advised me to join Light Expertise.
Okay.
Actually, I was searching for industries over here and was not able to find any job over here. I think there are very less industries.
Okay. Yeah. So in Australia, as we know that the fact is like Australia is not more towards the production side. Okay?
Yeah.
So we have like here in Australia, there are very few industries. So the best way is to become a pharmacist. Okay? So after becoming a pharmacist, like in case if we are interested, then we can go through the other sectors as well. Like there are few production industries also there. So if you want to go through that side, then we can go through that field, or we can go through mainly this what we say clinical research side. Okay, so that's a very good opportunity. So if you're a pharmacist, if you're fully registered pharmacist, if they go into the clinical research side, then they will have a high grade when compared to a non-registered pharmacist. So a non-registered pharmacist, they can also enter or they can also work in the clinical research side, but for them, the grade will be very low and the pay rate will be very low. But for pharmacists, if you have a licensed pharmacist, if they want to work in that field, then they will have a higher grade and the pay rate will be much higher.
Okay, sir. So secondly, I have a doubt regarding the handouts. When we have to study those handouts?
So handouts, like when we keep on finishing the lectures, so once the lecture is done, so you will attending the live lecture and you will watch that lecture. And after finishing the lecture, so for quick revision, you can go through the handout. So what will be the things that we teach in the lecture? So they will be there in the handouts, except like few things, because as we can't incorporate all the points in the handouts, we'll keep on giving a lot of live examples in the lectures. So like what we come across through when we see the patients in the hospitals. So those things that we keep on teaching in the lectures. But all those things, all those stories, like it won't be there in the handouts. So such things, what are the things that few things which are missing out in the handouts? So those things that you can just write it on the handout.
Okay, sir. Thank you so much for clearing
Yeah,
this doubt.
thanks, Mohini. Yeah, thank you.
Hello, sir. It's really very nice to meet you, sir.
Hi, Meghna. How are you?
I'm good, sir. Thank you. And how are you, sir?
Yeah, I'm good. I'm good. Thanks, Meghna.
I just really want to know something other than CAPS exam, sir, or pharmacist. I just want to know something which is about pharmacovigilance, which is also growing in Australia.
Yeah.
What is the certificate or qualification which is required for the pharmacovigilance, sir? Can you share anything about it if you know?
Yeah. So like for pharmacovigilance, they won't be like, first of all, in case if Meghna, are you here in Australia or still in?
Yes, sir. I'm in Australia, in
So you
Balwad,
are
sir.
here in Australia, okay. And you
Yes,
have a
sir.
valid visa, right, to work here?
Yeah, sir. I have visa.
Okay, then, okay. So those who have a valid visa, and if you want to try in pharmacovigilance,
Yeah. Yes, sir.
okay, so for you, it won't be a big hurdle, okay? So
Okay, sir.
you can try for the pharmacovigilance side, but again, even in pharmacovigilance side, if you want to go in that sector as well. So if you have a license, if you are already a licensed pharmacist, if you have the pharmacist license, then you will be provided like a higher weightage, okay? And your grade and everything will be higher if you have the pharmacist license. So always there will be advantage if we have the license, if we are already registered with APRA, then that registration, it gives a lot of strength for us, okay? So it will give a lot of support. But
Sir, I mean, like other than APRA, what is certificates or we required, sir? Other than APRA?
Okay, other than APRA, like I'm not exactly
Certificate
sure like
courses.
any certification course that are available, and if they are there. But the most thing is like what, even if we have the certification courses done, the important thing is that during the interview that they will mainly ask about our previous pharmacovigilance experience. So in case if we have any previous pharmacovigilance experience, even back in India, so it doesn't matter. So they will still consider those experience. So here in Australia, the most important thing, like getting into the first job, whatever
Yes,
it
sir.
is, like either even to become a pharmacist while looking for the internships, or either the industrial side or in the pharmacovigilance side. So anyway, so they mainly ask about the experience.
Yes,
So
sir.
if have any of the previous work experience, then that's the most important thing. So because they will ask the questions on what you know about this particular sector, and have you worked in this field, and so on. So that's the most important one. And as you were asking about the certifications, to be honest, I'm not sure like exactly like which certifications would be helpful for this pharmacovigilance courses. So if I come to know, then definitely I will share it with you.
It's okay, sir. Thank you so much, sir.
Okay, Meghana, thank you. So any further
Hello,
questions,
sir.
guys? Yeah. Hi,
Sir,
Irfan.
hi, sir. I have a quick question. After clearing the exam, what are the process we have to do about?
Okay, so after clearing this CAPS exam, then the next step is you need to get registered with APRA. So APRA is nothing but the pharmacy board. Like how in India or in other countries, like what we do is once after getting the graduation, so we will register in our state pharmacy council. Okay, so in a similar way here in Australia, so all the pharmacists, they need to get registered with the Pharmacy Board of Australia. So after clearing the CAPS, you need to have your English score as well. Okay. So after clearing both the CAPS and English language test, then you need to send all your documents to APRA. then APRA will assess all those documents, and APRA will ask if any further documents are required. Then you need to send those documents as well. Like they mainly ask about the criminal history check. Okay, so our police check should be done for those who are already here in Australia. So they need to do two types of the criminal history check. One is the federal check, which is done by the Australian police, federal police, and the other one is the international criminal history check. So in case if the candidate is from Indian background, and recently moved to Australia, then the candidate need to do two types of the police check. One is the international criminal history check for India, and the other is the federal police check for Australia. Okay, so these are the things, and also APRA will ask us to submit the good standing certificate. So let's say, for example, if you are from India or from Nepal or from Pakistan, from any country, it doesn't matter. So if you are already registered in those countries, and now you are going to register in Australia, in this country. So now Pharmacy Board, it requires the good standing certificate from your home country. So you need to ask your pharmacy council, the state pharmacy council, to send the good standing certificate. Then they will send the good standing certificate to APRA. Okay, so these are the important documents which are required. So once APRA receive all those documents, then APRA will assess those things, and in case if they require any further documents, then they will ask you to submit those documents. So once it is done, then you will get registered as an intern pharmacist. Okay, so you will get the license of the provisional license. So with that provisional license, you can start working as an intern pharmacist. So intern pharmacist, your internship will be for 1,575 hours. So you need to work under the supervision of a fully licensed pharmacist in Australia. Okay, so during that time, there will be two more assessments will be done. There will be two more exams. And at the same time, you need to enroll in the intern pharmacist training program. Okay, so in that intern training program, there will be some assignments and so on will be there. So you also need to do all those assignments and so on. It means that like you will be having 1 year time. So you'll be having 1 year time to finish your intern training program, and at the same time to finish those two exams, that is the written exam and oral exam, and also your 1,575 hours of supervised practice. Okay. So when all those things are done, then finally you will get the full license to practice as a registered pharmacist. So these are the steps which are involved. But anyhow, I will go in detail. I will explain in detail. So once you guys clear the KAPS examination, then after clearing the KAPS examination, I will conduct the sessions with you, and I will explain in detail now what is the next step that you need to do, what documents that you need to organize. So what documents that you need to send to APRA. So everything will be explained in detail.
Okay, sir. Thank you, sir.
Yeah, thanks, Irfan.
Hi, sir.
Hi, Khushbu.
Sir, I have a question regarding OET. I cleared OET back in 2016. So I just wanted to check with you, is there any validity for
Yeah.
the
So they
OET?
won't accept. If it is 2016, then they won't accept because the validity for all these exams, like for IELTS or PTE or for OET, hardly the validity will be for only for 2 years. Okay. So that's why, like, you can check with the APRA. So before you get registered, so you need not to think about it now. Like after you clear the KAPS examination, so you can we can check with the APRA, and they will let us know if it's valid.
Okay, sir. Thank you.
Okay, Khushbu.
Hello, sir.
Hi,
Hello.
Gayatri. Yeah, hello.
Hi, sir. How are
Hi,
you?
I'm good, thank you. How are you?
Yeah, I'm fine, sir. Sir, actually, I want to know about the sponsorship. If I have any friends or cousins in Australia, if the process will be easy to get
Yeah,
sponsorship.
the process will be easy in the sense like your friends or the cousins, they should help you in finding a job offer letter. So if they can find you a job offer letter from any one of the pharmacies, then definitely the process will become much easier. Okay, so if they find you the job offer letter, then then your process will get more smoother and easier. So there are different type of the visas, like 491, 190, 482, that is the sponsorship visa. And also if you want to just finish the internship, then 407 is also available, that is the training visa. So there are different type of the visa options are available, like, and if your friends or if your cousin, whoever are here in Australia, so if they can help you out in finding any job offer letter from any one of the pharmacies, then definitely it's going to be much easier for you. So there won't be any sort of hurdles.
Okay, sir. Thank you.
Yeah, thanks, Gayatri. Okay, guys, so thank you so much for attending this session today. And we will update the timetable for your classes. So we are going to start the classes from this week. Okay, so we'll soon update the timetable in the WhatsApp group. We'll send the timetable for your regular classes. Okay, so until then, like, thank you so much, and I'll see you in the lectures. Okay, so see you soon. Thank you.
Thank you, sir. Have a good night.
Yes, thanks so much. Thank you.
Thank you, sir. Good night.
Thank you, sir.
Yeah, thank you.
Thank you, sir. Good night.
Yeah, thanks, Mohini. Thank you.
Thank you.